Hello, I'm Dr. Melissa Merhege, and I'm one of the pain management specialists at the Lovelace Pain Clinic. I previously spoke with you about a spinal cord stimulator trial, and today's video is about spinal cord stimulator implantation. As a quick review, let's talk about why someone might want to pursue spinal cord stimulation. If you watched my previous video, we discussed low back and leg pain, neck and arm pain from various causes. Patients have undergone many modalities of treatment and are still not getting adequate pain relief and do not have sufficient quality of life and functioning. This may be a time to consider spinal cord stimulation. One of the very nicest parts about spinal cord stimulation as a modality of treatment is that there is a trial period before one would receive the final implantation. Let's briefly review the trial. It is a 7-day period in which the patient has leads placed into the epidural space, either in the thoracic or cervical spine, depending upon whether you're targeting the neck and arms or low back and legs. The trial differs from the implantation process in a few significant ways. First, the spinal cord stimulator trial is performed in the clinic without the need for sedation for the lead placement. Second major difference is that during the spinal cord stimulator trial, the generator or battery is externally affixed rather than implanted under the skin. So that leads us to what happens during a spinal cord stimulator implantation. It is performed in an outpatient surgical center with mild sedation, usually MAC. The lead placement is virtually identical to the trial process, but the difference is rather than externally affixing the generator or battery, the leads are internally tunneled and a pocket is created in either the right or left flank. And the generator is placed in this pocket, attached to the leads, and the whole system is sewn in so that there is no external part of the system. This is very nice in that the patients are not limited in their functioning, such as swimming, bathing, or other activities once they've gone through the healing process. So let's talk about what happens after a spinal cord stimulator implantation. It is required that the leads become scarred in place so that there is no movement of the lead from the original placement, or at least very little movement. Patients are asked not to do extreme bending, raising of their arms, or twisting of their torso. So this does require some pre-planning by the patient to create a home environment where they have things at arm's reach. Patients often find, after they've had a spinal cord stimulator implant, that they require much less pain medication. This is often one of their goals, in fact, in pursuing spinal cord stimulation. That being said, there is often some pain medication that is continued to be prescribed, and patients can still undergo other modalities of treatment, such as injection therapy as adjunctive and additional forms of pain relief. What happens if a patient, in rare cases, wants to have a spinal cord stimulator removed down the line? This is a simple process of reopening the pocket, taking the battery/generator out, and closing up the skin. The leads are left without consequence because it is contraindicated to try to remove them once they have become scarred and affixed into the epidural space. However, it is rare that a patient wants a spinal cord stimulator removed because, in general, after going through the trial and implantation process, they do achieve very significant pain relief. I wanted to show you what an actual spinal cord stimulator lead looks like. This is a lead with multiple electrodes at the terminal end, which is what supplies the stimulation. The spinal cord stimulator representative has multiple programs they can use and adjust as the patient's needs evolve and or to optimize their pain relief. Typically, 2 leads are placed both in the trial and the implantation. However, if for technical or anatomic reasons it is not possible to place 2 leads, 1 lead is often sufficient to provide the same amount or adequate pain relief. During the actual process, the spinal cord stimulator lead is maneuvered up the epidural space, and for low back and leg pain, it is placed in the thoracic epidural space, typically in the mid-thoracic region around T8 or 9. Likewise, in the cervical spine, the lead is placed into the cervical epidural space. Now, I previously stated that in general you're targeting low back and leg pain or neck and arm pain, but there are other indications for spinal cord stimulation, such as abdominal pain, pelvic pain, and there are new indications coming out all the time. Therefore, the lead placement is highly variable depending upon the target you are trying to treat. One might also wonder, how big is this generator? Well, in fact, it is quite small. It is only slightly larger than the size of $50, and as if you can see, it is no more than ½ an inch or so deep. As I referenced earlier, the generator is placed in the right upper buttock, low back area, or left upper buttock and low back area. There are some pre-surgical steps that a patient must go through, such as an EKG, psychological evaluation prior to a spinal cord stimulator trial and implantation, some basic blood work, as well as clearance from their primary care physician or other specialists such as cardiologists if needed. Also in the pre-surgical planning with the patient, we discuss where we're actually going to place the generator. There is some flexibility and variability around the laterality of the placement. If a patient tends to sleep more on their right or left side, a patient may choose placement of their generator based on where their pants or clothing and where the waistline is the least impactful. In general, once the spinal cord stimulator is implanted, it is typically a very comfortable and uninvasive type system that the patient hardly notices. If they have any recent implantation, it is almost certain that there will be MRI compatibility, and certainly the companies can inform you as the provider and the patient about any imaging limitations or special requirements, such as turning off the system prior to imaging and ensuring that it functions properly once the system is reinitiated. In summary, spinal cord stimulation can be a very effective and life-changing treatment modality for many patients. If you have any questions, please do not hesitate to contact any of the providers at the Lovelace UNM Rehabilitation Clinic. Thank you.